Volker, good to have you with us.
Thank you. Great to be here.
Now, government wants to provide universal health coverage for South Africans, which is a good thing, right? But the concern from a lot of private practitioners is that the bill itself is pretty silent when it comes to responsibility for medical indemnity. Am I correct with that first?
Yes, it doesn't seem to be addressed in full yet.
Okay, but firstly, from a layman's point of view, I should think a doctor should not be worried about that, because first thing you should be worried about, is my health and the fact that you are not going to make mistakes. Why is that such a big problem?
The problem in the context of the doctor's own liability has been, per the circular issued in the Gauteng Health Department, where they could be held personally liable as per the introduction.
Yeah.
A second problem from the doctor's resource point of view is that there is a high load in the health sector, and the NHI is trying to introduce more opportunity for service for patients. So the demand for medical services could well go up, but the supply, resources from the medical side, has not yet been increased at the same rate, perhaps.
So you're saying the demand, more people will be walking through the door because the NHI, which is a fund, will make it, it'll be affordable for them to walk through the door, but they don't have that many doctors. So the doctor will now have more patients to see, therefore more chances of mistakes happening.
Potentially, if there's pressure on service and big queues and other matters like that. Obviously, we're not saying that doctors are going to rush or be negligent, but there's a need to provide a much greater degree of services in a constrained resource, and perhaps the level of experience that's needed to deal with complex cases isn't always there, and it might be handled by younger doctors, or doctors who are not as specialized in one sector.
Which doctors will be more affected by this? Is it the more specialized doctors?
Possibly, because there are fewer of them, and the risk elements in complex surgery, whether it's neuro or the ops and gynae space, where there's higher traffic, obviously because many births take place as well, the overall exposure is higher in that kind of area.
Okay, now the Gauteng Department of Health has recently warned public sector doctors that they could be held personally liable for damages claimed as a result of patient harm. What led them to this point? Because there must have been a cut-off point where they say, okay, enough is enough now. We can't keep footing the bill as the employer. We're putting this in your hands. Why?
Well, I can't speak for them because I haven't had that direct experience within the department. I think the implication of that circular is that there are cases of perhaps gross negligence where the doctor did something beyond scope or beyond what they're trained for, even beyond what we call a Good Samaritan Act, where we would happily cover and protect a doctor for trying their best under emergency circumstances. Okay. And when there's that level of mistake or lack of attention, then I think they may have a point.
Okay, what's the solution? Is the currently stalled state liability bill the solution to this?
That's a technique for delaying and dealing with the money problem. We don't think that's the answer. We think there are very good answers, starting at the beginning of the risk, which is when the patient comes in, when the records start, when you prepare for the doctor for the patient, and you prepare the patient also for what's likely to happen, which is called consent. And there are adverse and complicated outcomes, so you prepare the patient for the exit as well, because not every difficult exit is negligence. Because we are complicated people. What
do you mean prepare? Are you saying that I must sign something to say, listen, if anything happens, what sort of preparation does the patient go through? Is that what you're talking about?
Yeah, the consent process is the preparation.
Isn't that a bit, I'm walking into a hospital here where I'm supposed to, I expect to be taken care of by professionals. I've got one leg, which is falling apart. I'm not going to be looking at somebody to sign here,
That's the flip side of the coin.
Yeah.
In the state where there are emergencies, there's so little time in many cases that the principal focus is diagnostics.
Yes.
In the private sector, you may have more elective surgery, more time to guide the patient, and there's a much more stronger doctor-patient relationship. So in that context, you can't then say a world-class standard must apply when the doctors had 5 minutes to see an emergency situation and get on with it. So, but by the same token, the patient may not get absolute world-class outcomes because they arrived as an emergency. So I think that's both the balance that one looks for.
When you look at the state's medical legal claims, estimated about 98 billion rand. That is a lot of money. Some of that malpractice and some of those mistakes, how much of that can you blame on infrastructure as opposed to actually the skill of the doctor, or it's the fault of the doctor?
If we break infrastructure into the hardware, the wards,
yes,
and then some of the resources, the skills,
yep,
and then services like records and data, those three buckets are important. So they do carry significant elements of that responsibility, yes.
Okay, so what do you say the NHI should be saying when it comes to medical legal claims?
The approach is this one of be prepared. So let's say we have R1 billion more to spend.
Yep.
Let's keep focus that if we prepare the front end of this well, we want to stop that 98 billion getting bigger. So if we prepare well at the beginning, we use our resources well, and we look after the patient through the exit, we'll reduce the consequential exposure.
And now some of the doctors are saying, listen, we could actually skip the country. They feel vulnerable. They'll have to move or leave South Africa. Aren't these a bit, isn't a bit of panic here?
I think one of the thoughts is that if there's no choice of your ability to deliver your service, that is a concern. There's a long, long road to travel before that kind of outcome takes place. So if there's a restriction on your practicing license, I think that would raise reasonable concerns.
Okay.
But we aren't there yet.
Okay. As Constantia Insurance Group, let me just ask you a quick one here. When it comes to the medical aid schemes, health insurance, so forth, how will this affect you, this bill affect companies like yourselves, service providers like yourselves?
We think there's a strong role for a balance between medical aids and people who provide another buffer to medical costs. For example, if you have a car accident and you need more money for your medical expenses that you didn't predict, that's very good for insurance business and a nice buffer, whereas a medical aid can't always provide that kind of cover on a countrywide basis. So it's actually good to balance the predictable area of medical cost in a medical aid and the unpredictable and other usage areas in an insurance environment.
Yes or no, NHI, a good idea from government?
It's a good way of building the capacity for wider healthcare. My personal view is that we can execute the resource better in the infrastructure we have.
All right, thank you so much. Constantia Insurance Group CEO, Volker van Widden.
You're welcome.
Great to have you with us.